So I think definitely collaboration with colleagues, peers, people who are in the field, maybe people that have done it a long time, much longer than you have as a new grad, would definitely help. This is where you can also think about having a mentor that can kind of ground you and let you know that you're headed in the right direction with treatment. But really, just talking about your cases with peers and bouncing off ideas and being vulnerable and sharing what you did, what you thought, and why, and really being able to articulate it and kind of think out loud. You will also have mentors that can really say profound things that can really change that mental gap that you might have. For example, I was always very hesitant of prescribing controlled substances. And I remember one of my mentors told me, well, if that patient is coming to see you, if they are following treatment guidelines and they're doing the drug tests, they're doing everything you want, don't you feel safer that they come and see you and check in and get this controlled substance from you versus getting it from someone in the street? And I know that's like a radical thought as far as, getting a prescription versus, getting it on the street. But that's the truth. If people aren't getting their needs met, clinically, psychiatrically, medically, they will find a way. So that's a brief example of how much impact a mentor can have. And I think when it finally clicks is when you have successful outcomes, when you have new patients that are difficult or easy. Let's just say they have anxiety and depression, and you start your first medication, they follow up with you, and they're doing a lot better. Every time you see a patient that is doing a lot better or a lot worse, you're going to improve your knowledge skill, and it's going to continue to kind of build this confidence where you're going to say, okay, I'm not going to do it this way because the last time I did it for these last three patients didn't work out this way, and maybe change that approach. But you're always going to be fine tuning your treatments, and that's why they call it a practice. But overall, once you start to treat people and they get better, that's really when the imposter syndrome and the confidence goes up.